Hello, everyone. Thanks for joining us for, I think, the first ever cannabis panel at the Players Technology Summit. Happy to say. Show of hands in the audience, how many people here have invested in the cannabis industry? So, a few, not too many. How many have used cannabis? We're in California, it's okay, it's legal. A few who are being honest, all right. So this is a new and burgeoning industry. Tremendous amount of change happening at a very rapid pace. We're in San Francisco, which is really kind of the heart of the push for change and has been since the 1990s, so it's an appropriate place to be doing this. Al, I wanted to start with you because you have the athletic background that I think will resonate with a lot of people in the audience. Tell us a bit about how you personally first discovered cannabis and then what led you to found Viola, your company.
Well, obviously, growing up in New Jersey, cannabis was always around me. And, the war on drugs was very real and it was scary. I was always taught that it was a gateway drug. So, especially being a young athlete, I decided to stay as far away from cannabis as I could. But when I got to the NBA, it was the first time that I realized that, athletes can use cannabis and still be very productive. Because, some of the teams that I was on, some of the best players on my team used to self-medicate all the time. So that's when I first realized that the stigma wasn't true. But fast forward, when I played for the Denver Nuggets, they had just went medicinally legal a year before I got there in 2009. I signed in 2010. So I was always reading the newspaper and always kind of, educating myself and kind of, setting myself up for a moment. And the moment happened when my grandmother, who was 79 years old, had come to see me play. And she was suffering from, all the things, that, black grandmothers, suffer from high blood pressure, diabetes, and she had glaucoma. So when she said glaucoma, I was telling her about 2 days before, I was reading about the benefits of cannabis for glaucoma. So she finally asked me, she said, well, what is cannabis? And I told her it was marijuana, weed. And she was like, reefer? She's like, I'm not smoking no reefer. She's like, there's no way reefer's gonna help my eyes. But, the next day, she was in pain again, and we talked about it again, and finally I was able to convince her to try it. So when she tried it, I took her downstairs. I had a game that day, so I went and took my little pregame nap. Woke up an hour later, and, I was like, let me check on her to make sure she's not climbing the walls or something. And I go downstairs, and I knock on the door, and her back was to the door, and I walked in. And I was like, Grandma, how you feeling? And she turned around, and she was crying tears. And she was like, I'm healed. She's like, I haven't been able to read the words of my Bible in over 3 years. So I went in the room, and, I hugged her, and I started crying with her. I'm soft like that. And that's what really inspired me to start educating myself about the benefits of cannabis. And eventually, I made my first investment. In 2014 is when we got our first actual license, and we decided to name the company Viola, which is my grandmother's name.
I want to come back to some of the medical benefits with all three of you in a bit, but Kevin, we did not introduce you by saying that you have an athletic background as well, but Kevin began his professional career as a football player for the Birmingham Stallions of the USFL League. So you too have personal experience with the athletic field, but then you moved into finance and then cannabis. So, obviously, as we've seen, this is a sector for huge potential for growth. But like any early stage industry, it also comes with a lot of risk. And it's sometimes hard to know when you look at all the companies out there that are pitching themselves what really is a good investment. So Acreage just closed on a pending deal with Canopy Growth Corporation, the largest Canadian cannabis company today. What criteria, so you're well established, but what criteria would you say people should be considering before they decide to invest in one of these companies?
I think when you invest in any company, and I have been a financier for most of my adult life before monetizing on a money management firm and then ultimately being a private investor, I was introduced to cannabis back in 2011, so very, very early on. And as a small aside, the gentleman that got me involved with cannabis was Katina Mobley, who had played a number of years in the NBA. He had called me in 2011 and asked me for some advice about the investment that he had made. I think he might have been a little over skis in the investment. I wasn't a cannabis person at the time, but I had seen the operating leverage in the business and ultimately learned about the medicinal value of the plant, and I was enamored that this will be the solve for the future, not only in healthcare but in wellness. But as it relates to making it an investment, I think the same principles hold true, whether it's in cannabis or whether it's in cable, whether it's in any other industry. If you don't have working knowledge of the space or of business, I think you can prosper by having good advocates and good people around you that can advise you on that. The one thing I would tell you and the one bit of advice I would lend is don't mix friends with business unless that friend is expert or as expert as most in the space. And I think that, when it comes to folks that have developed friendships over the year and they want to default to, their friends to get them involved with exciting things, make sure that that friend is also an expert in whatever they're investing in. And I'll be quite candid with you. There are a lot of ganjapreneurs in this world, right? Since it's now the fastest growing industry in the United States, but it's riddled with canna clowns. And you want to avoid those people because it is such a explosive business. There's a lot of opportunists out there that are looking to just basically, maybe a little bit not as genuine about the investment principles as maybe one should be. So
I think ganjapreneurs, that's a great term. Diane, we've spoken before. You run a venture capital firm called SX2. You're also CEO of the Jamaican Medical Cannabis Corporation. And in both of those, you sort of see the possibility of generating both investment returns but also doing societal good. So talk about how cannabis, I think a lot of us tend to associate it with recreational use, which is obviously a big part of the opportunity, but talk a bit about how it can cross the boundary between profit and social good.
Sure. So I am the co-founder of SX2 Ventures based in London. We founded SX2 to really focus on investing in the area of human care. So that's anything in health services, longevity. We're very comfortable in emerging markets, which ultimately led us to investing in cannabis in Canada really, really early. I'm Canadian. It was a very comfortable thing for us. We were invited to go to Jamaica and look at an investment. Originally said no for the point that Kevin made. I was like, ganja, Jamaica, not a chance. We are going there. Having said that, it kind of stuck with me. Went down, had a lot of discussions, talked to the government, did our homework, became very comfortable with that investment. SX2 requires that any investment we make anywhere in the world has a societal give back. We reject the notion that because there's a societal benefit, you have to in some way compromise making profit. Our model actually proves that's not the case. So, for example, I use JMCC. It's our largest investment right now. I'm actually running it because we didn't just invest in it, we founded it. And in that case, we also founded the JMCC Foundation, where we reinvest 10% of our net profits back into the communities around where we work and our employees live. We have, for example, are the exclusive grower for the first phase human trials of the FDA's first acute myeloid leukemia drug, which is cannabis-based. That's actually with a Jamaican company. And so in support of that Jamaican company, we are doing the growing for those trials at our own expense through our foundation. We have invested in a protection of the indigenous strains of Jamaica to ensure that those strains are around generation to generation, because as we're in this high demand for recreation, these crazy THC levels are going to start to over-hybridize true medicinal strains. We have to protect them and make sure they're around, not just for the island, but for the future. So those are the kinds of things that we do. I would also add we grow in a collective, which is a collection of farmers on the island. We work with them in terms of international quality standards, training, development, fair wages. We give benefits, which isn't normal or as normal as we'd like to see it. And in that collective, they actually own 51% of the collective company. So they will benefit from growing the highest possible quality product.
I want to come back to the clinical trials side of things in a second, but Al, I was watching a really interesting video on your website where you talked to former NBA Commissioner David Stern, who was really tough on drug use with athletes when he was there. And you got him to say some pretty interesting things. He said, I'm now at the point where personally I think it probably should be removed from the banned substance list in the US. And he also said, I think we've got to change the collective bargaining agreement and let you do what's legal in your state so that athletes who live in states like California where cannabis is legal should be able to legally partake without being punished for that. So that's a pretty dramatic shift in view from him. But do you think this will actually happen in the NBA and other professional leagues? Do you see things starting to change?
Yeah, I think it's going to happen sooner than later. You know, I think the NHL during this season, they was going back and forth, you know, trying to decide if they was going to actually legalize, you know, the players being able to use CBD. I think CBD is kind of our gateway into sports. You know, I think the perception obviously is the thing that everyone is concerned about. You know, I always use an example of, you know, if cannabis goes legal or the NBA says it, you know, players can consume, and Steph Curry missed 10 threes, everybody's gonna say he's hot. You know what I'm saying? So obviously, you know, teams want to stay away from things like that. But, you know, with CBD, you know, I feel like THC and CBD, you know, is this an alternative way for, you know, for guys to medicate themselves? Because we all know, you know, the dangers of opioids from, you know, it being addictive and just, you know, the side effects and different things like that. But cannabis doesn't have any of that, you know, and my thing is that, you know, if the teams and these organizations want what's best for the players, they should take a deeper dive into the cannabis plant because there's something there. You know what I'm saying? I mean, I have stories of, you know, people that have had, you know, terminal cancer and started getting on a THC CBD regimen, and, you know, there's no cancer in their body. You know, so there's something there, and I think that just the teams need to invest the money and the time into finding out, you know, what's really good for these players, because we know that the opioids is definitely not it, you know, especially when it comes down to quality of life after they're done with the game.
Kevin, I know Acreage and Canopy are working, I think, with the NHL Players Association, right, on co-sponsoring a study in Canada. So talk a bit about your view of the medical potential of cannabis, you know, specifically for athletes, because I think the NFL, too, has expressed some willingness to be open to this. But also, more broadly speaking, some of the work you're doing on the clinical trial side of things.
Well, as stated earlier, my initial attraction to the space was as much about the economics as it was about the healing capability of cannabis. You know, you hear these stories every day that, you know, it's anecdotal stories about, you know, the child that goes from 70 seizures a day to 1 a month. There's nothing anecdotal about that story to the parents of that child. And believe me, see that child transform his or her life is inspiration enough to want to go the next step. 95% of this country still believes in medical cannabis, yet it's still a Schedule I drug. And so the hypocrisy that we live with in the United States, it's our goal to change that. But as it relates specifically to athletes, whether it's a baseball, football, basketball, you name it, skiing, under tremendous physical stress. And, you know, as Al pointed out, opiates are not the solve. And to give you a sense for that, I have a number of private investors that had invested with us pre-going public. And one of those was one of the top surgeons in the world and said to me, Murph, I had no idea 5 years ago when I was prescribing oxycodone that it was going to have such a damning effect on some of the people that I was basically prescribing those to. I personally have a very dear friend who got injured playing football, went the protocol of taking the opiates. He hanged himself 3 months ago because he couldn't deal with the opiates and he ran out of money. If cannabis was in his life, I promise you he'd be living today. And so we're passionate about the medical side of it. Yes, it's a tremendous business. There are tremendous returns to be had in this business, but it's so far outweighed by the fact that we can change people's lives every day, as Al points out, from cancer patients to concussions to PTSD. There's 23 million veterans in this country that choose to give their life or choose to risk their life every day, but they can't choose cannabis in their life. And the reason they can't choose cannabis is because it's a federal program. If the armed forces finds out that a veteran is using cannabis, they lose their veteran rights. As a matter of fact, we have a veteran, a storied veteran, who spent 3 years of his life overseas. He basically came to work for us. West Point found out he was working for us, not using cannabis, working to help provide compassionate care for others. They took his pension away. Here's a guy that basically was in harm's way in live fighting for 3 years of his life and now has no pension because cannabis is still a Schedule I drug. To me, you know, it is absolutely so sad, frankly, and we're going to look to change that with the people we've surrounded our company with, our board of directors, and the executives that we have on board. So,
Diane, I know JMCC is involved in several different clinical trials that are happening both in Canada and elsewhere. Talk a bit about some of the research that you're participating in and you know, your hopes for where that will lead.
Sure. So JMCC in just 2 years is now in 5 countries. I think that speaks volumes to the recognition that there are therapeutic and medicinal benefits of this product, and governments around the world are starting to see that. We have almost, I think, 34 countries now that have changed that. So as we look at that and we really are trying to push the agenda in those new markets, it's not going to happen if there isn't solid sharing of medicinal scientific information. And so it's a big part of JMCC's mandate to support scientific communities that are doing that. We are in a PTSD trial with the Gold Coast University and a licensed producer in Australia. That's a grower, a cultivator in Australia. It has a big veteran part of it, which we're very proud of because, to Kevin's point, there's a significant benefit for this product to veterans who have served their countries. We are in the acute myeloid leukemia one, which I mentioned. We are in 3 mental health trials out of the University of Western Ontario in Canada. They're specifically in the area of psychosis and anxiety. There's a few more in there in the oncology area for prostate cancer and breast cancer with the University of Wilfrid Laurier. And then also we have big oncology trial for, it's more pain management and sleep deprivation related to the impact of taking cancer treatments, because it's not a this or cannabis, it's a collaborative approach to medicine. So we really believe that the scientific data that so many governments have been saying no longer exists does exist, and the sharing of that. We are also hosting a very large scientific symposium in London in September. I'm an advisor to the CMC, which is one of the groups helping shape the UK's policy there. And so in that, we're bringing the scientists from around the world to the scientific community in the UK to try to accelerate the understanding of the benefits, the kinds of things that Kevin and Al were talking about that he experienced with his grandmother, but also so that there's an opportunity to potentially take the learnings that are happening in other parts of the world and accelerate that into potentially expanding these trials into the United Kingdom.
It's interesting to note that almost all of this research is being done outside of the United States because it's still very, very difficult to conduct clinical trials here in the U.S. because cannabis remains a Schedule I drug. Mm-hmm. Al, I want to come back to you. We've talked a lot about how cannabis can help improve people's lives through medical use, but what about improving people's lives through actually getting involved in the business side of things?
Yeah, well, you know, like Kevin had mentioned, you know, obviously this is a huge industry, and you know, just to kind of talk about what I represent for the space. You know, I represent diversity, you know, because I've been in this space now since 2011 for the most part. And, you know, I go to events, and when I get there, I'm the only person that looks like me. And when we think about, you know, what drugs, especially cannabis, has done to the black community, you know, I think that there needs to be more representation. You know, when we think about, you know, industries before cannabis, right, sugar, cotton, alcohol, the lottery. You know, minorities, specifically black people, had their hands in. They were there pioneering, but now there was no representation. There's no ownership. So what I want to do and what I'm, you know, set out to do is try to, you know, be a company to create opportunities for other minorities to get into the space and have ownership. Because this is going to be $1 trillion industry. And, you know, if we can just get 10, 20% of that, you know, it could be generational wealth for our communities. You know, we're always talking about reparations, but I think this is a way that we can take reparations. If we can get that opportunity to be able to be a part of this industry. Because you think about it, you know, 20% of a multi-trillion-dollar industry, that'll definitely rebuild our community. You know, so that's, you know, that's something that I represent, and that's something that I, you know, I reach out to others about why they should actually get involved and stop being so afraid of, you know, the perception of what other people think, and kind of think about it, you know, this is something that's bigger than them. And if we can get in and get together and pull together as a unit, I think that, you know, we can have a lot of change, and we can do it through this plant, a plant that, like I said, destroyed our communities, and I think we can rebuild it.
We only have about 3 minutes left, but I wanted to see if there were any questions in the audience, because this is probably a new space for a lot of people. I don't know if... Do we need a mic? Or?
You've been asking, I'll repeat it.
Okay, go ahead.
So Al, I'm a lifelong Warrior fan. I know you and Don Nelson had rough patches here and there. Since you've gotten into this business and he's now in that business, have you guys blazed together? And then second question, what are your thoughts on how to best, you talked about Steph missing the shots, right? So
right.
like, what are your thoughts on like how to like make sure, you know, how do players use it but also not impact the game? Like how do you regulate that, right? Because back in the 70s and 80s, you had a lot of players, you know, on code, on everything, playing the game. There was a problem for the league. So have you thought about that?
So the first question is, I'm looking for Nelly to definitely smoke. I heard he got some Maui Wowie that's fire, so I want to check it out. Second, I think that the way that, first of all, I'm going to give you guys a news flash, right? The players are already using it. You know what I'm saying? Like real talk. And you see the product that's out there on the floor. I think the game is as good as it's ever been. You know what I'm saying? And the one thing I think that people have to give the players is a little bit more credit, that we respect our craft a lot. You know what I'm saying? It's like, I'm not going to go, when I know I got to play against Victor Oladipo, I'm not about to go and smoke before that game. You know what I'm saying? I need everything I got to guard him that night. You know what I'm saying? But, you know, when you talk about how do you know, gauge it right now, that's tough because there's no way to know if a guy's high, different things like that. And then, you know, because cannabis, you know, when it's in our body, it makes us all feel differently because our endocannabinoid system or whatever, you know, I don't really have an answer to that of like, how can you say if this guy's high? But I would just say that, you know, most guys, you know, respect their craft enough that they're not going to go out there and not be able to give it their best.
Did I just steal your question?
Oh, sorry.
Thank you.
Yeah.
My question for all three of you is really in regards to the pharmaceutical industry as a whole. And my question to you guys is, what's your guys' take on transparency? Meaning, what are you guys telling your consumers? Like, when the question is asked, what am I smoking? What are your guys' answers? Because that's obviously a trending obstacle that we see today in every industry, right? The food industry, pharmaceutical industry, and really you guys, right? The biggest question is, what is this strain and how can we verify that?
I'll take a crack at it. You know, knowledge is power, and we actually have grown a business to the extent that we now have a balance sheet where we can do a lot of testing. We can do a lot of discovery around the plant. And so it's maybe as much about the strain as it is about what effect it will have. And so we do a lot of work on predictability, dosability, experience, and consistency of that experience. And it's simply because we don't want people to have a bad experience or a bad outcome if they're looking to it from a medical standpoint. And so I think as we do more study and as the federal government allows us to do that, that will enable us to be more intelligent about it. Now, we've reached outside of the United States to do that same work that we should have the opportunity to do here, but we don't. And so we spend the money outside of this country to basically import it into this country and be more knowledgeable about it. So that would be my answer to that question.
Diane, final word to you.
I would say, JMCC is not an end patient. We are a cultivator. We have one job: grow the highest possible product that goes then to companies, biotechs, and LPs that turn it into patient product. Like Kevin, testing is critical. We test throughout our grow. We test 2 weeks before harvest. The product must leave Jamaica and travel into any country with actual data that says it is this strength, it was tested on these dates. So the product leaves like that. I know, I'll speak for Canada. Health Canada requires a very, very strict standard on top of that to the product that is then going to patients. Now, patients also have a duty, however, to really go and understand where they're buying their product. With the greatest respect to people in my country, if you're buying it from the Indian Reserve, you're probably not getting a medicinal product. They're doing the best they can, but they're growing it outside. That's not a medical product.
All right, unfortunately, we're out of time, but I think everyone will be around for a little while if anyone else has additional questions. Thank you all.